If your legs swell up every evening, if your ankles look twice their size by the time you get home from work, if your shoes feel tight by 3 in the afternoon, if you avoid shorts because of the puffiness, I need you to watch this entire video, because there is one kitchen herb that published research shows acts as a natural diuretic, and you probably have it in your fridge right now. 1 in 5 Americans over 50 deals with persistent swelling in their feet and ankles. That is 20% of older adults walking around with legs that feel heavy, tight, and uncomfortable every single day, and most of them are either ignoring it completely or spending $20 to $50 a month on prescription diuretics. Medications that come with a list of side effects nobody warned them about. Medications that require blood work and monitoring. Medications that cost money month after month after month. It is parsley. That garnish you throw away at restaurants. That little green decoration most people push to the side of their plate. A study published in the Journal of Ethnopharmacology confirmed that parsley acts as a natural diuretic. The results were clear and peer-reviewed, and it costs about $1 a week. But how you use it matters. That is what most people get wrong. I am going to show you the exact preparation, the timing, and 3 mistakes that cancel the effect. Stay with me. Welcome to the Hidden Cost Health Hub. If you have not subscribed yet, hit subscribe and the bell. This is where we dig into research that sits in medical journals, but nobody promotes because there is no profit in a $1 herb. Now let me show you why your legs swell. During the day, gravity pulls fluid downward. Blood and lymph settle into your lower legs, ankles, and feet. Your kidneys filter the excess. Your heart pumps blood back up. Veins push fluid against gravity using tiny valves. When any part slows down, fluid pools. Your tissues absorb extra water, and your legs swell. This is peripheral edema, one of the most common complaints for adults over 40. A study published in PLOS ONE found that this condition remained remarkably consistent at 19 to 20% prevalence among older Americans for nearly 2 decades, and it is linked to reduced mobility, pain, and lower quality of life. Think of your legs like a sponge. During the day, gravity fills it. Your body is supposed to squeeze it out. When it cannot, the sponge stays full, and your legs pay the price. Your body just needs help releasing the extra water it is holding on to. Now, what I just showed you is the basics. But there are 37 foods research links to reducing inflammation and fluid retention, including 5 that support kidney function and water balance naturally. I compiled everything peer-reviewed research documents, but nobody promotes into the Hidden Cost Health Hub. 37 anti-inflammatory foods. 47 blood sugar studies simplified. 20 years of heart research condensed into the guide your cardiologist wishes patients would read. 15 daily habits linked to chronic disease and how much each costs you in prescriptions. 42 foods neuroscientists eat. 31 sleep studies. 101 research-backed foods in 1 almanac. 7 guides. 400 pages. 250 studies. 1 place. Less than a doctor copay. First link in the description. But stay here. The most important part is how to prepare parsley correctly. In 2002, researchers Kreydiyyeh and Usta at the American University of Beirut published a landmark study in the Journal of Ethnopharmacology. They found that parsley extract inhibits the sodium-potassium pump in the kidneys. That pump controls how much water your kidneys hold or release. When parsley inhibits that pump, kidneys reduce sodium reabsorption. Less sodium means less water retained, and the extra fluid your legs have been holding gets released naturally through urine. In simple terms, parsley tells your kidneys to let go of the water your body does not need. Here is what makes parsley different from prescription diuretics like furosemide. Prescription loop diuretics force your kidneys to dump potassium along with the water. That is why doctors have to monitor your blood levels. Low potassium causes muscle cramps, weakness, irregular heartbeat, and fatigue. Parsley is naturally rich in potassium, so research suggests it supports fluid release without depleting this essential mineral the way synthetic diuretics can. A Brazilian study published in 2009 confirmed that parsley seed extract increased urinary flow and sodium excretion while lowering blood pressure. 2 teams, 2 countries, 2 decades. Same result. It helps your kidneys release the extra water for about 15 cents per cup. If you have made it this far, you know more about this than 99% of Americans. Subscribe and share with someone whose legs swell every evening. And everything research documents but nobody profits from is in the complete hidden cost health hub. First link in the description. Now stay with me. This is where it gets practical. Take a 1/4 cup of fresh parsley. Curly or flat leaf both work. Chop it roughly to release the oils. Bring 500 milliliters of water to near boil, not rolling. Between 80 and 90 degrees Celsius. Pour over the parsley. Steep 5 to 10 minutes. Strain. Drink warm. 2 to 3 cups per day. Timing matters. Morning and early afternoon only, not evening. It is a diuretic. Drink it at 8 p.m. and you are up at midnight and 2 a.m. That does not reduce swelling. It moves the problem to your sleep. The 3 mistakes that cancel the effect. Mistake 1. Drinking at night. Disrupts sleep without reducing daytime swelling. Mistake 2. Using only dried parsley. Dried has some active compounds, but fresh has significantly higher concentrations of the oils and flavonoids responsible for the diuretic effect. Mistake 3. Not reducing sodium. Parsley helps excrete sodium, but at 3,400 milligrams daily, the American average, parsley cannot compensate. 80% comes from processed foods. Reduce those, and parsley works dramatically better. Combinations that amplify the effect. Parsley tea plus elevating legs 15 minutes above heart level. Gravity drains fluid back toward your kidneys while the parsley helps them flush it out. Parsley tea plus dandelion leaf tea. These are the 2 most documented natural diuretics in published research, and they work through complementary mechanisms. Parsley tea plus a 20-minute daily walk. Walking activates your calf muscle pump that pushes blood and fluid upward against gravity. This is called the venous muscle pump, and it is one of the most effective tools against leg swelling. Parsley tea plus sodium under 2,300 milligrams per day. That last combination produces the most noticeable results within the first week. Cost comparison. Parsley tea runs $1 to $2 per week. Generic furosemide without insurance averages $11 to $25 monthly at retail. Anti-edema supplements cost $30 to $50 monthly. A $1 herb with published research behind it. Always consult your doctor before making changes to prescribed medication. But the studies are published and available for anyone to read. So what happens when you start drinking parsley tea consistently? Here is the timeline most people experience. Days 1 through 3. You will notice increased urination. This is the parsley working. Your kidneys are releasing the extra sodium and water they have been holding. Do not be alarmed. This is exactly what is supposed to happen. It means the active compounds are reaching your kidneys and doing their job. Days 3 through 7. You start to see visible reduction in the swelling around your ankles and feet. The puffiness starts to soften. Shoes that felt tight begin to feel normal again. Some people notice the difference as early as day 4. Others take the full week. Week 2. The difference becomes consistent. Sock lines are less deep. Ankles look more defined. Legs feel lighter by the end of the day instead of heavy and tight. This is the point where most people realize something genuinely shifted. Weeks 3 and 4. When combined with reduced sodium intake and daily walking, the results become dramatic. Many people report that the swelling they thought was permanent starts to feel manageable for the first time in years. Most people notice a meaningful difference within the first week, but give it at least 2 full weeks of consistent use to see the cumulative effect. This is not an overnight miracle. It is a simple daily habit that research supports. Now, I need to get serious with you for a moment, because swollen legs can also be a sign of something that requires immediate medical attention. Parsley tea is for mild, occasional swelling, the kind that builds up during the day from gravity, from sitting too long, from being on your feet. But swollen legs can also indicate more serious conditions. Heart failure. When the heart cannot pump blood efficiently, fluid backs up into the legs and lungs. Kidney disease. When kidneys lose their ability to filter properly, fluid accumulates throughout the body. Deep vein thrombosis. A blood clot in the leg that can be life-threatening if it breaks loose and travels to the lungs. Liver disease. When the liver cannot produce enough albumin, fluid leaks from blood vessels into tissues. Chronic venous insufficiency. When the valves in your leg veins weaken, blood pools in the lower extremities. Here are the warning signs that mean you should see a doctor immediately. Not tomorrow. Today. Swelling in only one leg. This can indicate a blood clot and is a medical emergency. Do not wait. Chest pain combined with swollen legs. This combination can signal heart failure. Swelling that appears suddenly and worsens rapidly over a few days. This is not normal gravitational edema. Skin that is red, hot, or painful over the swollen area. This may indicate infection or clotting. Shortness of breath alongside leg swelling. This requires urgent evaluation. Parsley tea is not a replacement for medical treatment for heart, kidney, or liver conditions. If your swelling is severe, sudden, or in one leg only, see a doctor today. Now for those with mild everyday swelling, let me show you what else research says can help. Dandelion leaf tea. Like parsley, dandelion has documented diuretic properties in published research. It works through a slightly different mechanism, and the two complement each other well. You can alternate between parsley tea in the morning and dandelion tea in the early afternoon. Cucumber. High water content with a mild natural diuretic effect. Easy to add to meals or eat as a snack. It supports hydration while gently encouraging fluid movement through the kidneys. Watermelon. Contains citrulline, an amino acid that supports blood vessel function and healthy circulation. Plus, its high water content supports overall hydration and kidney function. Ginger. Anti-inflammatory properties that research links to improve circulation. Reduced inflammation in blood vessels means better fluid return from the lower extremities. Add fresh ginger to your parsley tea for a combined effect. Garlic. A natural vasodilator, meaning it helps relax blood vessels. Better blood flow means less fluid pooling in the legs. 2 to 3 cloves daily with meals is the amount most commonly referenced in research. You do not need expensive supplements. Your kitchen already has what research says can help. Now let me give you the 5 lifestyle changes that cost $0 and can transform how your legs feel within 2 weeks. Elevate your legs for 15 to 20 minutes per day. Ideally above heart level. Lie on your back and rest your legs against a wall. Gravity becomes your ally instead of your enemy. This alone can reduce end-of-day swelling noticeably. Walk 20 to 30 minutes per day. Your calf muscles act as a pump that pushes blood and lymph fluid upward. Without movement, that pump stays dormant and fluid accumulates. Even a slow walk is enough to activate it. Reduce sodium to under 2,300 milligrams daily. The American Heart Association recommends this as the upper limit. Most Americans consume 3,400 milligrams. The excess comes almost entirely from processed and restaurant foods. Read labels. Choose low-sodium options. Cook at home more. This single change amplifies everything else on this list. Consider compression socks if you stand or sit for extended periods. Graduated compression stockings apply gentle pressure that helps veins push blood upward. They are available without a prescription and cost $10 to $20 for a quality pair that lasts months. Drink more water. This sounds counterintuitive when your body is already retaining fluid. But dehydration actually triggers your body to hold on to even more water as a survival mechanism. Staying properly hydrated tells your kidneys they can safely release excess fluid. 6 to 8 glasses daily. These 5 changes cost nothing and work alongside parsley tea to create real measurable improvement. Imagine putting on your favorite shoes next week and they actually fit comfortably. Imagine not hiding your ankles anymore. Imagine waking up with legs that feel light instead of heavy. 2 weeks of parsley tea, and these simple changes can make that happen. If you take blood thinners like warfarin, talk to your doctor first. Parsley is high in vitamin K, which can interfere with blood thinner medications. Pregnant women should also consult their doctor before using parsley in medicinal amounts. These are important safety considerations. If this video helped you, subscribe. I post videos showing what research says is already in your kitchen that may support your health naturally. And if you want the complete system, the 37 foods, the 250 studies, the full protocols for inflammation, blood sugar, heart health, brain function, and sleep. The Hidden Cost Health Hub is the first link below. Over 7 guides, 400 pages of research made simple, for less than what most people spend on a single bottle of supplements that have 0 published studies behind them. First link in the description. Tomorrow I am going to show you something about your kidneys that 90% of Americans do not know, and how one simple daily change research links to protecting them long term. Subscribe so you do not miss it. Parsley tea, 2 to 3 cups a day, morning and afternoon, with less sodium and a daily walk. Give it 2 weeks. Your legs will thank you. See you tomorrow.